Which of the following is a possible complication of amniocentesis? A. Needle injury. B. Miscarriage. C. Rh sensitization. D. All of these. The answer is D. All of these. There are several risks to amniocentesis, including, but not limited to, miscarriage, infection, needle injury, and Rh sensitization. The rate of miscarriage due to amniocentesis is between 1 in 300 and 1 in 500. The other complications listed are relatively rare. Fundal height of a pregnant woman is measured from dash. A. The middle of the pubic bone to the bottom of the uterus. B. The top of the pubic bone to the middle of the uterus. C. The middle of the pubic bone to the top of the uterus. D. The top of the pubic bone to the top of the uterus. E. The bottom of the pubic bone to the top of the uterus. The answer is D. The top of the pubic bone to the top of the uterus. Fundal height, sometimes referred to as McDonald's rule, is measured in centimeters from the top of the pubic bone to the top of the uterus. The top of the uterus may also be called the fundus of the uterus. It is used to assess the growth and development of the fetus inside the womb. Alex is 17 weeks pregnant. She comes into the clinic to get an alpha-fetoprotein test. A low result could indicate all of the following except dash. A. The gestational age of the baby is incorrect. B. Preeclampsia. C. Fetal trisomy 18. D. Hydatidiform mole. E. Fetal trisomy 21. The answer is B. Preeclampsia. Alpha-fetoprotein is made by the fetus. Congenital abnormalities, fetal trisomy 18, fetal trisomy 21, are associated with low levels of this protein. Additionally, so is hydatidiform mole. Hydatidiform mole is the presence of an abnormal mass or growth inside the uterus. Based on a low result, the physician may want to conduct further testing. Preeclampsia is a dangerous medical condition characterized by high blood pressure. It is not associated with alpha-fetoprotein. The nurse is assessing a woman in labor. He knows that fetal bradycardia occurs when the heart rate drops below dash. A. 110 beats per minute. B. 120 beats per minute. C. 90 beats per minute. D. 100 beats per minute. E. 130 beats per minute. The answer is A. 110 beats per minute. Fetal bradycardia is recognized when fetal heart rate drops below 110 beats per minute for 10 minutes or longer. The normal fetal heart rate is between 120 beats per minute and 160 beats per minute. Fetal tachycardia is a heart rate above 160 beats per minute. Anne, a 32-year-old woman, presents for her first prenatal visit. The doctor orders a CBC, complete blood count. Which of the following is not included in a CBC? A. Blood type. B. Hematocrit. C. Hemoglobin. D. White blood cells. E. Platelets. The answer is A. Blood type. A separate test called a type and screen is needed to assess the blood type. Complete blood counts, CBCs, typically contain hemoglobin and hematocrit, platelet counts, white blood cell counts, and red blood cell counts among many other measures. They are among the most frequently ordered laboratory tests by providers. The physician will use this information to diagnose conditions such as anemia. The nurse is assessing fetal heart rate in a pregnant patient. The nurse records a pulse of 82 beats per minute. The nurse should dash. A. Ask the mother to lay on her right side. B. Call the physician immediately. C. Try another Doppler device. D. Add lubricant to the Doppler's surface. E. Move the Doppler device. The answer is E. Move the Doppler device. An 82 beat per minute reading could be the mother's heart rate, indicating that the nurse does not have the Doppler in the correct position. A normal fetal heart rate is between 120 and 160 beats per minute. The nurse must always remember to take the mother's pulse before assessing the fetal heart rate. Before calling the physician, it is important to determine that the data is accurate. To increase oxygen perfusion to the fetus, ask the mother to lay on her left side. Brittany is 40 weeks pregnant and calls because she is seeing pink-tinged discharge for the first time. The nurse should tell Brittany to dash. A. Continue to monitor. B. Call an ambulance. C. Lie on her back and place her feet in the air until help arrives. D. Drive to the hospital immediately. E. Eat a bland diet and continue regular exercise. The answer is A. Continue to monitor. This is most likely the normal bloody show at the beginning of labor. There is no need to immediately arrive at the hospital, change position, or eat a bland diet. The patient should continue to monitor and call back or seek care when she experiences regular contractions that are becoming more intense and frequent. Sarah is a 17-year-old female who has not gotten her first period and is visiting her doctor for an exam. She has displayed the normal growth and development of several secondary sex characteristics. The nurse would describe to the doctor that Sarah is showing signs of dash. A. Oligomenorrhea. B. Primary dysmenorrhea. C. Secondary amenorrhea. D. Secondary dysmenorrhea. E. Primary amenorrhea. The answer is E. Primary amenorrhea. Primary amenorrhea occurs when a female is 14 years old and has not gotten her first period and has not developed secondary sex characteristics. Primary amenorrhea also occurs when a female 16 or older has not gotten her first period but has developed secondary sex characteristics. Primary dysmenorrhea refers to painful menstruation not linked to a physiological disorder. Secondary dysmenorrhea refers to painful menstruation due to an underlying cause such as endometriosis. Oligomenorrhea refers to the absence of a period, typically for at least 35 days. Amber is a 39-year-old woman who is experiencing secondary dysmenorrhea. The nurse knows that Amber could be suffering from which of the following? A. Amenorrhea. B. Low levels of aldosterone. C. Endometriosis. D. Turner syndrome. E. High levels of prostaglandin. The answer is C. Endometriosis. Secondary dysmenorrhea refers to painful menstruation due to an underlying condition. Endometriosis, an example of a condition that frequently causes secondary dysmenorrhea, refers to the growth of uterine tissue in inappropriate places such as the ovary or rectum. High levels of prostaglandin are frequently found in women with primary dysmenorrhea, which is painful menstruation without an underlying condition. Low levels of aldosterone would not likely cause painful menstruation. Turner syndrome is a chromosomal disorder that can frequently cause amenorrhea, or absence of a period. A nurse is assessing an 18-year-old woman who has come into the emergency department for bilateral abdominal pain. Which of the following should the nurse not consider a risk factor for ectopic pregnancy? A. Neisseria gonorrhea. B. Yeast infection. C. Uterine fibroids. D. Chlamydia trachomatis. E. Endometriosis. The answer is B. Yeast infection. Uterine conditions such as endometriosis and uterine fibroids increase the risk of ectopic pregnancy. Endometriosis is the inappropriate growth of uterine tissue outside the uterus. Uterine fibroids are benign tumors within the uterus. Sexually transmitted infections can cause a condition called pelvic inflammatory disease, which can result in scarring. Scarring of the reproductive system greatly increases the risk of ectopic pregnancy and infertility. Yeast infections are common after antibiotic therapy and are treated with an over-the-counter medication. They generally do not cause permanent damage to the body.